Australia is renowned for developing life-changing medical technologies, including the bionic ear, spray-on skin, the cervical cancer vaccine, and the ultrasound scanner. Our scientists and researchers continue to innovate, driven by a desire to solve global health problems.
The Stentrode is a world first minimally invasive brain-machine interface. So this is a technology that can record neural signals and translate these into commands that can be used by people with paralysis to control wheelchairs, bionic limbs and prosthetic arms. The Stentrode is implanted via the blood vessels to the motor cortex, the part of the brain responsible for movement. Hopefully this technology will return some movement and independence to the millions of people worldwide with paralysis. This is certainly a very good time to be doing this. There's an excitement around this area of medical bionics, and Melbourne certainly is one of the best places on the planet to be doing it, and I'm very fortunate to be here now and be involved in this sort of work.
The focus is rapid diagnostic testing, and particularly testing for diseases that have a high burden in global health. Applications like HIV, malaria and dengue fever, diseases that impact millions of people. Before we set up Atomo, rapid testing was done with chemistry set style bits in a box kits. In the lab they work quite well, but when you try to do that type of testing in the field in Africa, the test kit is quite difficult to use. It's not very easily understood, and that leads to a lot of errors. And what we've done is integrate that functionality into a single, easy-to-use device, which makes it safer and more reliable, but also allows people to test themselves. The device itself can really support a wide range of blood-based testing, so there's many applications that we can bring onto the platform, and we're looking to do as many as we can, but we have focused initially on global health. What we're doing matters, and I think that gives us the energy to keep going.
ResApp is a digital health company, and we're developing tools for the diagnosis of respiratory disease using a smartphone. Typically in a respiratory disease, they use a stethoscope to listen to the chest and listen to the lungs. In a telehealth consultation where you're talking to the doctor over a video, you can't use a stethoscope. So ResApp provides that doctor with a very accurate way of performing that diagnosis. They can perform an instant, accurate diagnosis that leads to treatment.
Respiratory diseases is the main reason why people visit a doctor. Pneumonia is the third leading killer of the elderly and dominant killer of children under 5 years of age throughout the world. What we have demonstrated is unique. Using cough alone, we can get very high accuracy in diagnosing pneumonia, which makes the technology available throughout the world.
We've got a great opportunity to make a huge impact to people's lives, something very unique about our solution.